My name is Jennifer Fugo. I'm a clinical nutritionist and host of the Healthy Skin Show podcast, and my practice is based outside of Philadelphia, Pennsylvania. Some factors that may be overlooked when someone visits a dermatologist could be things like nutrient deficiencies. There are gut issues that can be involved. So your gut microbiome is a community of organisms that should be in a very specific balance that helps you as an individual and as an organism be healthy. But there are times when that can become skewed or dysbiotic. And so it's no longer in this healthy balance. And unfortunately, that can cause a whole slew of inflammatory issues. And then also we can't forget gut function. And gut function is basically the process of breaking down nutrients from food, even potentially things that are supplemental, so supplements or medical foods, etc. And then being able to absorb or basically extract the nutrients and pull them into the body. And so when there is something off in those two camps in terms of the gut itself or the GI tract, that can also cause a whole host of problems. That being said, I do want to stress that the nutrient deficiency or even insufficiencies, your labs may not look deficient in terms of the numbers. So it still might be in the normal range, but it may be trending low. And what's low for one person may not be the same for someone else. And you may, because of a variety of factors due to stressors, different requirements for the need that your body has in a given moment for particular nutrients. So your need might be higher than just what the quote unquote daily need would be for a general human being. But also different medications can deplete certain nutrients. And so we have to keep that in mind, especially as nutrient quality in our food may not be up to par, or you might be burning through those nutrients faster than, say, someone else, your friend, your family member, again, due to a variety of factors. So those would be the general things that I would say. I will also add to that, just came to me, diet is certainly a factor. I don't think it's the end all be all, but everyone eats so differently. And depending on your financial capacity to be able to provide a healthy, balanced diet varies, right? Some individuals may be on food stamps. Some people may really struggle to even eat whole foods. And so that is usually not assessed and typically blown off as something that is not an issue that anyone needs to worry about. But we don't make nutrients. So if you don't make the nutrients, where do you expect to get them from? And then of course, if you have gut function problems and you're not actually breaking the nutrients down and absorbing them, then whatever you're eating, no matter how whole foods based your diet is, no matter how healthful your diet is, you can still end up with nutrient deficiencies. So those would be the top things that I would say as a clinical nutritionist that tend to get overlooked. The gut can contribute to skin issues in a variety of different ways. As I already mentioned, gut function is one piece of the puzzle. We need to chew our food mechanically, right? That's breaking it into smaller pieces. It then goes to the stomach where we should have a sufficient amount of stomach acid. The environment of the stomach should be extremely acidic, usually somewhere around a pH of 1, and the purpose of that is to break chemical bonds between proteins. So proteins are made up of amino acids, and the bonds between the amino acids require this extremely acidic environment in order to break apart. So when you consume things like protein, for example, you can't just absorb it as protein. It's not like you eat chicken and then chicken is in your body, a part of you. That's not how it works. We break it down into these amino acid sequences and absorb them that way. And the same goes for nutrients as well. Nutrients, some of them are bound chemically to proteins, specifically B12 and iron. And you need, again, that acid to break them off. If you don't have sufficient acid, they continue to pass through. And so again, you don't get access to those nutrients because they're still bound together, so that as we get down into the small intestine, we then have pancreatic enzymes that help break down those smaller fragments of amino acids into the little amino acids that they are. It's like Legos. You know, you have this big giant Lego and you break it apart, and each individual Lego piece is an amino acid. In the small intestine is where the majority of nutrients are absorbed. And so if absorption is compromised in any way, and we also need, I should add, bile. So bile is actually produced in the liver, and then it is sent to the gallbladder to be stored and concentrated. And bile is also very crucial because it helps us to solubilize fats. We cannot absorb them without sufficient bile. And when things get into the stomach, food is being digested, it sends an actual hormone signal called CCK to the gallbladder. It's really kind of cool, this whole like signaling system. And CCK causes the gallbladder to squeeze or compress out the bile to solubilize fats. And it's basically like dish soap. So if you had a greasy pan, you're not going to be able to clean it with water. You need dish soap. And so bile is that dish soap that, again, breaks things into those smaller pieces and allows the body to absorb them. And so if you do not have these steps in place working correctly, there is no backup systems for any of this, by the way. So there's no backup for low stomach acid. There's no backup for inappropriate amounts of bile. You end up with food down in the large intestine where now it's mixing with the gut microbiome. And so unfortunately, that is where we can start to have inappropriate things happen. Now, granted, if you had, so this is kind of like where the blending of the gut microbiome and gut function come together, because there are organisms that live all throughout the GI tract. Mostly we have a smaller amount of organisms in the small intestine, but when that gets overgrown, we call that small intestine bacterial overgrowth, or SIBO. And so obviously that can be impacted by certain starches. So there's that. But then if things like the different food, proteins and such get down into the large intestine where the bulk of the gut microbiome is, now all of a sudden you have organisms that could be healthy organisms, part of your commensals. That's what they're called. Gut flora are also called commensals that should be there. They start to eat that food that should not have been fed to them. And so they are essentially dining on amino acids and other things that should have been absorbed higher up in the GI tract. And unfortunately, that can cause dysbiosis, so further imbalance of the gut microbiome. It can cause issues where, say you have organisms that really shouldn't be there. If they get access to certain things like iron, we were talking about how you need stomach acid to break the bond between iron and proteins. And one of the main problems with iron ending up in the large intestine is that research shows us that it will actually cause certain organisms to become even like stronger. So even more like you've got a problem child, well, now they get even worse. And so that's another reason why you're losing nutrition. That's why there's no guarantee of food, the type of diet that you eat, guaranteeing that you're going to have healthy labs and healthy levels of certain nutrients. But now this gut dysfunction drives the gut dysbiosis, or gut imbalances of the microbiome, even further. And so not only are you inadvertently, I want to be very cautious here because it's important that people don't feel a sense of blame as if it's something you chose to do. It's a dysfunction and a imbalance that unfortunately can drive itself. And there are things that you can do, but it's no one's fault per se. It's just if we don't know this is happening, there's nothing we can do about it. But you're feeding these organisms food that they should not have had access to in the first place. And like when bacteria ferment proteins, it actually causes products of putrefaction, which is as awful as it sounds and is very toxic for the body. And then some organisms will also produce different toxins as a result of exposure to these food proteins. And then also you poop some of them out. And so you are literally making, to some degree, kind of expensive poop. So this is where the gut, number one, we need the nutrients, right? In order to generate healthy skin, we need nutrition. Number two, we need a healthy balance of commensals, not this imbalance that's then further being driven in a direction that is not supportive of our health, because imbalances can drive inflammation. And those inflammatory messengers that a lot of people don't understand, because the term inflammation is sort of vague. We don't know what it actually is. Those can actually, while they're generated in the GI tract, they can show up someplace else, including the skin. And so those are some of the ways in which the gut, especially gut function and the gut microbiome and diet, can be connected to chronic skin issues and the inflammation we see on the skin. The way that the gut is connected to skin inflammation and some of these skin issues like atopic dermatitis is that there is typically some sort of problem going on, or maybe a series of problems with gut function as well as the gut microbiome. And when gut function is not operating optimally, and this is important to understand that there are no backup systems in gut function. So if one system, like say the stomach, where we need a sufficient amount of stomach acid, is just not happening correctly, and so we should have a pH of 1 in the stomach, but now say you have a pH of 5, so you're not able to break down foods correctly, all of a sudden every system after that is compromised. And that then impacts the gut microbiome and feeds into this dysbiosis, or an imbalance in gut flora. And that can look like unfriendly gut bacteria, can include parasites, can include fungal overgrowth, bacterial overgrowth in areas where we really shouldn't have a lot of bacteria, like in the small intestine or the large intestine. And what happens with this imbalance then in the gut microbiome is that it can generate inflammation, and inflammation can look like various things. But I think it's important to know that inflammation is something specific. It's not this vague concept that we talk about in the wellness world at all. And that inflammation, or those inflammatory messengers, so to speak, end up someplace else. They don't stay within the GI tract. And that's how they can end up then on the skin in various areas and contribute to what we know as eczema. Inflammation is something very specific. It's not a vague concept. It's not this internal fire. That's oftentimes how it's described online. And so this was described to me actually by Dr. Heather Zwicky on the Healthy Skin Show podcast, because I asked her, I was like, what exactly is inflammation? And so inflammation is associated with cytokines, and cytokines may appear to those who are dealing with chronic skin problems like eczema or psoriasis or whatever condition that you may have, or series of conditions that you may be diagnosed with. They might feel really bad, like they are not your friend. But the reality is that they are basically chemical messengers. And Dr. Zwicky described them as essentially emails. So think about it, you're in your house and say you have some intruders coming into your house. So you would start calling the police, you would start calling someone to come to your home. Not that you would send emails, but for this example, let's just say you're sending emails trying to recruit help to your house. And so essentially there's something there that shouldn't be there, and your body is using these cytokines or chemical messengers, so to speak, to ask for help from your immune system to this very specific location. And when this problem is left unchecked, and this constant production of cytokines is being essentially just like it's it's like a wildfire, so to speak, and nothing is helping, your system's not able to clear it and deal with it, we then end up with this quote unquote inflammation that can show up. For some, it may be their joints. And for those of us who've had skin issues, it can be on the skin as well. If you're wondering how to actually deal with this imbalance between gut function and the gut microbiome and how it then impacts the skin, the first thing is to really take a step back and assess each step within gut function. And it does not mean you have to do a variety of complicated tests. There are blood labs that even just seeing, for example, low iron show up could be a red flag that something is going on. Having low stomach acid, looking at your stool or bowel movements and the color, or considering, are you more constipated or more on the loose side of things? So a variety of things that we can gather of what's going on with gut function that could be a problem. And then from there, the other option is looking at the gut microbiome. And there are stool tests on the market that can be helpful. Nothing is perfect, so please don't buy into any of the claims that we know everything. We do not. They're still giving us an idea of what's going on, but that can be helpful to pair the two to identify issues, whether there's depletion in certain really crucial gut commensal organisms like certain bacteria, or if there's overgrowth, say, of fungal organisms, or if there are even parasites present. And by using then potentially diet changes and different herbs, even medications, there are different avenues forward to help someone rebalance this whole community as well as the functions and processes that should be happening. And so know that there's a lot of tools. It is manipulatable or correctable. So I don't want anyone to think that they're stuck with it. But by doing that, you actually can decrease that cytokine production that then shows up someplace else, like on the skin, and can help reduce the severity of the symptoms. I've even seen, for example, clients who've had severe constipation, where they're literally maybe having a bowel movement once every 3 to 5 days, which is really constipated. When they get their bowel frequency increased to once a day at least, they actually are less itchy, their skin is less inflamed. It's wild, the connection between the body, because it's all one being, right? There's systems that communicate to one another that we traditionally don't. Like, you go to a gastroenterologist for your gut, you go to a dermatologist for your skin, but it's one body. And so there can be a lot that you can do to help rebalance things. Food fear is extremely common in any chronic skin rash condition, especially eczema, and even within TSW. And I understand in many regards why this can happen. I think what I've found is that people become very frustrated with not feeling as if they're being provided enough options when they see their dermatologist. You know, you've already gotten rid of your detergents, you've changed your body care products, you might have gone and bought all these water filters for your shower. You are doing, your sheet, you might change your sheets and your bedding. Like, you might get rid of your pets. Some people even do that, or rip out the carpet. I mean, you do all of these things and you're like, I still have these problems. Can I do something else? And so that's where diet comes in. Diet is something that you're exposed to different foods every single day. And if you go into any Facebook group or a forum online, or you read any books geared towards a particular skin condition, I don't know right now if there's there's Facebook groups for TSW specifically, but if you go into any of them and you're like, how am I supposed to eat? Or do you recommend I cut out certain foods? And you're going to be bombarded with this lengthy, exhaustive list, leaving you feeling like, what am I supposed to eat? Should I just be breathing air? And even you're gonna probably walk away with feeling like your water is poisoning you too, and probably the air is too, and you're just overwhelmed because it's unsustainable. And so what happens is that people start to associate, for everybody watching this, you are very well intentioned. And I understand you want to be the partner that your body needs to heal and to get to a place where you don't necessarily need to rely on medications on a daily basis. You just want like the normal things in life, right? It's not like you're asking for some crazy trip around the world. Like you're not, most people just want to be a parent to their child. They want to go to work. They want to get up in the morning and just get ready, eat breakfast, and go to work and do the normal things that people do without ever having to worry about what their skin's going to do that day. And while yes, diet can be helpful, I don't want anyone to think that diet can't be helpful. The problem is where we start to think that the food is what's driving the inflammation. So essentially, because you think that, you then pit yourself and your body against food. Food is now the enemy, right? We develop this mentality of being at war with something that should be seen as nourishment. We need food in order to survive. Your body does not make all the nutrients it needs to thrive, so we have to bring it in somehow. And when you take out foods, you may notice that it's hard to reintroduce them, as if you become more reactive to them. So that only reinforces that, oh, this food was bad. And so everything gets looked at through this lens of good versus bad, not realizing that it might not actually be the food itself. Many people don't have an actual IgE allergy to these foods. And what they don't realize is that there's this imbalance between gut function and the gut microbiome. And it's what happens to the food while it's moving through the GI tract and what it kind of intermingles with and plays with in the gut that is actually driving the problem. And so we're looking at the food as if it's the issue, but it's not really the issue. And so I think it's important to identify if you are developing a fear of food, to talk to somebody about that, whether it's a therapist or some sort of nutrition practitioner that has the credentials and the training to actually work on helping you to reintroduce the food. And I will also say this, if you have a history of eating disorders, do not follow elimination diets. You need guidance if you are planning on eliminating things, because research does show that it is highly triggering to those with a history of eating disorders to start eliminating foods. And I'll be honest, you should not feel like you have to trade your mental and emotional health and well-being just to heal your skin. I don't feel like it's a one or the other. I think, and actually I know that there is a way forward without having to sacrifice your ability to nourish yourself and enjoy those beautiful moments that we know as, like, you know, celebrating a birthday, going out to eat with friends. You don't have to feel like you're at war with food. There are a lot of myths out there that can actually hinder someone from healing. And it's things that I see frequently on the internet. If we go back to nutrient deficiencies, your body cannot heal in a state where there are nutrient deficiencies present, because they are literally the building blocks you need to do anything from a biochemical level. Even to heal skin, if you're not able to consume enough protein, for example, where do you think the proteins come from? They're not manufactured within our cells. It is something that, while we may produce small amounts of nutrients that your body needs, in general, if you are not able to absorb B12 efficiently, for example, with time, you're going to end up in a deficiency state, and that can impact your nerve endings and your methylation cycle and all sorts of other things. And so I think that's one area where, when people get into doing detoxes and cleanses, if they're not looking at the fundamental pieces of, like, I need to give my body the tools, it needs to just do what it needs to do. If you don't focus there, that's where you're going to miss the biggest, I would argue, bang for your buck in terms of healing, because it's sort of like a mom who doesn't have the resources and toys and various things to entertain her children and deal with the household and whatnot. You're just making it extremely difficult for your body to function on levels that you probably don't have any education on. And when I learned about nutritional biochemistry, I was shocked at how nutrient dependent some of these functions are, even with liver detox. So nutrients are crucial. The other thing that I would say that people oftentimes ignore would be the gut microbiome, and specifically with probiotics. There's a lot of myths that if you take probiotics, that your skin's magically going to get better because probiotics support your gut microbiome, which they do and they can, but there are plenty of instances where probiotics can actually work against you. They're so ubiquitous throughout, oh my goodness, buying products online, going to the grocery store, you can find them pretty much anywhere. And they're all marketed as beneficial for the body. But if you have small intestine bacterial overgrowth, if you have overgrowth in the colon, if you have histamine intolerance, if you have certain conditions that, or, this is a good one, if you have excess or high levels of lactobacillus species in your GI tract, which you would not know by looking at your stool or anything, and you take more of that, and so you're supplementing with really high doses of probiotics, you may actually get worse. And it can impact not only how you feel within your GI tract, but it can cause a whole host of other problems inadvertently. And you might wonder, why am I getting worse? And it is possible, unfortunately, that probiotics could make those issues worse. So there's a pro and a con to everything. And I know that everybody wants a really clear-cut, simple answer, right? We want the 120 characters or less, 2 cute little lines smashed together that you can remember. But the reality of it is that this is complex. Your body is unique. Your gut, your mitochondria, your skin, your everything is unique. And so what works for one person may not work for you. And that doesn't mean you're broken. It just means that you might need a different approach to supporting your body. I first learned about TSW a number of years ago. I was working with a client who was dealing with severe eczema. Well, that was the diagnosis she was given, but she was so exhausted, had completely wild sleep patterns that would vary so greatly. And even when she would get a good night's sleep, she was, and that was few and far between, but she was extremely exhausted. She had swollen lymph nodes. She had zingers. She had all of these things. And her doctors did not know what was going on with her. And I'm looking at my textbooks for clinical nutrition and diving into like all of these rare diseases like porphyria and whatnot, trying to figure out what was wrong with her because nothing made any sense. And some things that we would try that would work with other cases, for example, she had a lot of nutrient deficiencies, and I was using higher therapeutic doses of supplements to try to get those levels back up, and it was such a slow process. It just didn't make sense. So I guess at one point she was Googling and came across Preventable on YouTube and watched the whole thing and said, she actually shared with me that it was like this light bulb moment. She realized that that completely explained her entire experience. Going, oh my gosh, that's me. That's what this is. And so she messaged me and sent me the link to your documentary. And I watched it and sat there, grateful, but also horrified that I'd never heard of such a thing, that I had no idea that this was even a thing that could happen to people. And on another hand, I was angry that this is happening to people. And so through her experience, I became exposed to TSW. And I'm really grateful that I learned about it, because what I see in practice a lot of times is that these clients who have TSW don't know that they do. Some do, but some don't. And so they'll see a lot of integrative practitioners, and the integrative practitioners assume that it's severe eczema and try to address their health issues as if it's severe eczema. and they get so much worse. They can't tolerate protocols, they don't feel well, and part of the reason why is because TSW is a completely different, I would say, beast in and of itself. And you have to approach those cases, from what I have learned clinically, in a different vein than I would with atopic dermatitis or some other chronic skin problem. There's more things to consider. And it was a real eye-opening moment for me, and it explained why my father, who was a surgeon, he had given me topical steroids when I was dealing with dyshidrotic eczema, but he had warned me to use the steroids as little as possible and as infrequently as possible. He never explained why. So I had no idea why, and I don't even know that he would have known the exact, like, I don't know that he knew about TSW, or at least what that would look like. I think he knew that there were potential side effects that could impact the adrenal glands, because my father had a PhD and he was very well read on things. But I'm so grateful that I had that warning, because I was very careful with them and fortunately did not develop TSW. But I think Preventable was such an eye-opening educational moment for me as a practitioner, and helped me be a better practitioner to those who really needed to know, they needed that type of support. They needed somebody who believes them and who also understands the complexities of everything that's going on. And then it's not just some crazy cluster of diseases or illnesses or syndromes all overlapped on top of one another. It's really something that was drug induced. Common complaints that I hear from TSW clients tend to be things like they can't sleep at night, they are chronically exhausted, their hair is falling out, which that usually, it's interesting. They'll say that they can deal with the skin ramifications, but when the hair starts to go, feels like almost like the straw that breaks the camel's back. They have zingers, and so they're dealing with pain issues. They at times, are shedding tremendously. Their skin barrier is so compromised. They feel like they're reacting to one food this week and then something totally different the next. And they really, some unfortunately can't work anymore. And they're just emotionally spent. And so there's a variety of things that I wish that we knew more about. We need more research to better understand why some of these things are happening, because I feel like right now we don't know enough to effectively help support the body's process of Dr. Heather Zwicky, whom I interviewed on the Healthy Skin Show, called it almost like a rebooting of the immune system because of the exposure to steroids for whatever period of time it is that drives that particular individual's TSW. But I wish that we had more research. We need more research. And part of that is getting more doctors on board to help us understand what's going on. And that's where we are right now. There's so much we don't know. And I think part of it comes down to being creative. And I'm always thinking outside of the box, like, oh, that's interesting. Could this help this particular issue? Because right now in conventional medicine, we're using drugs to kind of band-aid or manage the symptoms. And there's nothing necessarily wrong with that, because it is a truly horrific situation that some individuals go through. And if there's any semblance of quality of life they can get back from using a certain medication or even using certain types of supplements, I mean, I'm all for that. I think quality of life is a big factor, and especially as TSW drags on for what can be years for some individuals. I have one client who had TSW for 15 years. And so, yes, there's time, but how long are you supposed to wait? I do think biologics can actually play a helpful role. I know that a lot of people tend toward one camp versus the other, But again, back to that suffering point, no one can know truly the level of suffering that you're experiencing, only you. And so if you're a mom and you literally can't be there for your baby, if you can't be there for your kids, if you can't have any semblance of a really good quality relationship with your spouse, if you can't work and you need to work, if you can't sleep, look, sleep deprivation for one night, maybe 2 nights, maybe 3 nights, it's doable. You can push through. You might use some coffee, what have you. But when this is months, years of not sleeping, that has a truly detrimental impact, not only on your body and from a cellular level, but also on your mental and emotional health. And so quality of life has to be considered. So rather than feel, I'm just going to say this is my opinion, and this is coming from a person who never has done biologics. I was only exposed to topical steroids and topical antibiotics when I was going through eczema. So you can take this for what it's worth. But I have found that clients who are really struggling and who find the right biologic drug to at least lessen the symptoms, right? To kind of almost like tap out for a moment, calm things down, get all the symptoms to a place where like you can deal with this. You have a better quality of life while you do all the other work, while you're doing the gut work and the diet work and the adding in more nutrition, all that stuff. It allows you to have more flexibility and to do it so that you're not just suffering, because nobody wins a prize for suffering. No one wins a prize for that. And just because one biologic drug doesn't work for you, you could try a different one. There are different options. There's also now JAK inhibitors, and you can do these medications concurrently or at the same time as all of the alternative stuff. With an immunosuppressant, that requires a different way of addressing things because of the way the drug is metabolized in your liver. So certain herbs, and there's actually quite a few of them that are used within more like a functional or integrative approach, may not be an option for you. So it's important that if you're on an immunosuppressant, you work with a practitioner that is knowledgeable on what those interactions are. But we work with that all the time. Clients who either come to our practice on a biologic with a goal to get off of it, or maybe in the process, they just can't tolerate all of the different things they need to do to rebalance their system. And that biologic gives them way more flexibility. They can handle utilizing different tools much better, and they have a better quality of life, and they sleep, and they can eat more foods and just be a human being. And you can do them together. So never feel like you're a bad person or you're weak or any of the names that you hear people called online or you think about yourself. None of that is true. I think every person's journey is unique, and you should feel comfortable doing whatever best suits your particular case with no shame and no guilt, because you can wean off of those medications and your doctor can help you do that in conjunction with your other practitioners. And I want people to know that your journey should not look like everybody else's, and it's okay if you feel like they need to be one of the tools in your toolbox. The question about whether drug companies are intentionally trying to hide the side effects or not is something that I really don't know. It's something that, we could suspect. But here's the thing. I think it's fascinating that especially doctors who, by the way, my dad was an MD and a surgeon. So I want to say that up front. So there's no amount of hating on doctors at all, because my dad was a doctor. But I do think to some degree, if we're going to have a serious conversation about side effects of topical steroids, which are very easy to find on the internet or in the brochure that comes in the box, you can't say that there are no side effects to a patient who is questioning them, but then on stage say something completely different. So for example, I was at the Integrative Dermatology Symposium in 2021, and I happened to attend a talk that was sponsored by a drug company. And so the doctor on stage was going through the profiles and benefits of the particular drug, and in the middle of all of this mentions something to the effect like, and this drug, it was a biologic drug, does not have the same side effect profile as topical steroids. And I was just looking around the room at all of these dermatologists, completely flabbergasted. I'm like, did I just hear that correctly? And no one is flinching. No one is looking like that's a strange thing to say, to acknowledge that there are issues with topical steroids. And so it's now being used as a marketing point for doctors to potentially have them offer it to their patients. And I'm not saying that there's a right or wrong way to introduce medications to your patients. I'm not a doctor. It's not my wheelhouse. But I do think that it's odd that you'll say to a patient there's no side effects of topical steroids, but then on the other hand, the way that the drugs are marketed or the doctors are educated, maybe that's the right way to phrase it, that there's not the same safety issues and side effect risks as with topical steroids. I just think that's interesting. My view of TSW as a clinical nutritionist is probably a little bit different than what most people view their own experiences of TSW, in that when I look at TSW, it's a condition that's layered over top of whatever skin condition you were diagnosed with. So when you go into TSW, it does not mean that you leave behind eczema or psoriasis or seborrheic dermatitis or a combination of whatever it is that you had before. You now have this as well. And so I think that also underscores one of the mistakes that is made, assuming that everything becomes about TSW, when in reality, the conditions that created the original problem are still there. And so if you only fixate on TSW, but you ignore the underlying root causes of what drove the problem in the first place, it's not like they magically disappear. If say, for example, you have a parasite infection and SIBO and other issues, it's not like they magically disappear just because you go into TSW. Nutrient deficiencies aren't going to just disappear. You still have those factors, and you have to view it, unfortunately, as now another piece of the puzzle that has to be addressed. It's just we have to be careful about how much we push things, because TSW does not allow the body the level of flexibility as a person whose HPA axis is functioning normally. So those are just some things to consider, because I see a lot of times people get fixated on TSW, but it's not the only thing at play in their case. I am not in the camp that giving it time is the only option that is available to those with TSW. I mean, I would ask the question, what would you say to a client of mine when I started working with her had TSW for 15 years? Do you think that at 15 years, give it time, is fair? And in reality, she had a plethora of issues going on under the surface that no amount of time was going to clear up. So while yes, time is a factor in all of this, I don't think that give it time is the only factor, because some people do experience a complete resolution for the most part of all of their symptoms, but that is not everyone. And I would say that most clients who have more of like the quote unquote like long haulers version, where they're still going through this at like 3, 4, 5+ years, they have other issues going on under the surface that no amount of time is ever going to correct. And to tell someone to give it time is literally telling them to do nothing, to take care of underlying health problems that is not only driving the severity of their condition to an even worse standpoint and worsening their quality of life. But you're inviting someone to ignore clear symptoms of other chronic health problems. And so, yes, time and other things could be going on under the surface. And I wish that there was not such a debate about this, because everyone is different. And while I'm so happy for those who have given it time and come out on the other side, there are also people who go through TSW and all of a sudden their eczema comes back. And I work with plenty of these individuals. So if you have been promised that all of your symptoms will magically disappear at the other end of TSW, know that that is not necessarily fact. And again, this underscores how we do not understand this condition. And also, one person's experience is not the same as someone else's. And we need to allow for a variety of experiences to be shared so that people can know what their potential options are and make an educated decision about what to do. The reason that there appears to be a financial disparity between the way that conventional medicine, say, bills the patient versus the way that more integrative or alternative practitioners bill their same patients or clients is that, first of all, your doctor is billing you for a fraction of an hour. Most doctors do not spend an hour with their patients. So I know this because my dad was a doctor and I did the medical billing for his practice before my career now. And so he would typically see a patient for anywhere between 8 to 15 minutes. 15 minutes and maybe longer if it was really severe, but usually we tried to keep it contained. And all practices operate that way, that the doctor has to see a certain number of patients in a certain period of time in order to be profitable. Because if you're not profitable, the business cannot stay open. And so when they bill you as the patient, you are paying most likely a copay or a coinsurance, which is a fraction of what the actual bill is, because the insurance company may pay something or they have negotiated rates. So you're paying a lower amount based off of your coinsurance, your deductible, etc. But it's still for a fraction of the hour. And if you go and look at your insurance explanation of benefits, you will see how much the doctor actually billed for the time. And office visits can range anywhere from like $60-ish all the way up to almost $200 for a 10-minute visit. And so that doesn't include testing they may do in the office and anything else that may be incurred on that during that visit. You also have less access to your provider. Even though you might have a portal, they may or may not respond. And they also, a lot of times people feel like unsupported. They don't feel like that time frame is enough to really get through the nitty-gritty. Whereas when you work with an integrative practitioner, you have their full attention. The amount of time that I guess I'd have to spend as a nutritionist arguing with the insurance company, because there's a lot of problems that the general public is not aware of that goes into accepting insurance, is time that I spend working on your case, spending time researching studies, talking to colleagues, thinking about your case from a much different perspective, and having direct access to me to ask me questions whenever you need help and to get personalized advice about different matters that are within my scope of practice. And there are even times where I am helping a client understand how to better advocate for themselves and ask for help when they go to the doctor's office, because they go in and they feel like they're completely, unfortunately, blown off. And so in my practice, it's important that clients feel like they have a partner along the journey with them. Whereas a lot of times they may not feel that way about their doctor or whomever is their actual provider. And that's a sad reality. It's not all doctors. There are some amazing physicians and dermatologists and PAs and all sorts of things who are brilliant and who really care about their patients, but the model is vastly different. And also keep in mind that scope of practice is different. And so the things that doctors can provide you advice on they have to be within what is allowable for them to not potentially have their license yanked by whatever state that they are licensed within should someone file a complaint against them. So if you wonder why they're not counseling you about your diet or they're not recommending certain supplements, it's because it's not within what's considered the standard of care for their particular profession. I understand the frustration, but in the same regard, there are ways that you can get creative, especially on the integrative side. There are different, like for example, that was one reason I created the Healthy Skin Show, was because I wanted to give back and I wanted people to have access to information that they could potentially bring to their dermatologist if they couldn't for whatever reason, and people can always afford the integrative option. I think it's important to have knowledge on your side that could take, like especially with research, could take up to 10 years to make it down into the exam room. That's 10 years of time that you could have known about the study. You could have brought it to your provider, but it just sat because no one knew to talk about it, to share about it, to read it. And so I think, we all start at different points in this journey, but there are benefits to both. And I also just want to underscore that they can be done together. They don't have to be at odds with one another. Whatever allows you to be a better advocate for your health is so incredibly crucial. I went to a GI doctor and I said, hey, I want to get treated for this particular, it's like some type of, I think it was Citrobacter, Brachy, and Enterobacter something or other, both of which are pathogens. So the doctor said, look, we'll treat you with rifaximin. But rifaximin is a very expensive medication. It's an antibiotic that stays within the GI tract. That's what he wanted to treat me with. The nurse calls me like the next day and says, listen, your insurance is telling us that we cannot prescribe that because you have not first tried an antidepressant, an antispasmodic drug, like all of these other drugs, and failed at them first. And I was like, but I have infections. Why would you treat it with like an antidepressant? That would be malpractice. But that was the requirement in order to get that medication paid for. Elimination diets can be somewhat helpful in TSW. However, the fundamental problem is that TSW causes this reactivity throughout all the different kind of like surface areas. So you see this breakdown of the skin barrier, but we also have similar cell tissue that lines the GI tract. And so it's not uncommon for someone to be sensitive to something 1 month and then the next month it's a whole different group of foods and now they're able to tolerate what they once couldn't tolerate. I think it's crucial, especially given the mental and emotional impact of TSW, to try to keep someone on as much food as possible that they can tolerate. Because as you start taking away more and more things and you feel like your life is also being essentially like chipped away to nothing, that can feel like you lose any ounce of happiness and joy and normalcy in your life. And so we need to weigh both. When we use elimination diets, we need to weigh how long and how severe or how strict we need to be on them, as well as somebody's eating, if they have an eating disorder history as well, and ultimately get them on as wide of a variety of foods as possible. I do think some eliminations might be appropriate, but in all honesty, there are things like the low histamine diet that I've seen recommended, to do a low nitric oxide diet. In all honesty, I think they may or may not. I haven't found them to be incredibly helpful. I think there's pros and cons to those. With time, I think you have to, again, weigh all these factors. And being on elimination diet long-term is not good for nutrient diversity and diet diversity, which directly impacts the gut microbiome. So we have to weigh a variety of factors. And And like I said, TSW is so complex. We have to consider what the initial problem was to begin with. And perhaps if we deal with that, it might eliminate the need for even doing a really restrictive elimination diet, because you're actually dealing with what's causing some of this dysfunction in the first place. I noticed online that there tends to be a lot of fear around supplements because people will start to dig into what a particular supplement is, and they'll see somewhere in this long scientific name the word steroid. And they assume that that particular vitamin or substance is a steroid, is the same type of hydrocortisone that they have been using topically. And I would say that we need to be really careful if you don't understand and have no training in that with like a scientific background to know what things are. Like, one could argue that vitamin D is a steroid because it's a steroid hormone. There are plenty of things that fall into that category, but they are not the same thing as hydrocortisone. And so when you're trying to make decisions for yourself about what to include or not include, it may be worthwhile, instead of doing a super deep dive that ultimately more information generates more fear, to reach out for help, even just to get some guidance around even just the nutrient side of things, like what vitamins or minerals may be best for you, by somebody else who actually has that training. I mean, I'm not fixing my pipes if there's a leak, right? I have no training in that. I don't want to make it worse. And there are years worth of training that someone who is, say, like a registered dietitian or a clinical nutritionist has in helping them make those decisions based off your labs and your symptoms and whatnot. And so even just a little bit of guidance sometimes could lead you out of a place of fear and paralysis to actually taking action that your body really needs. In terms of certain drugs and the side effect profile, and also, again, back to that idea of like they can deplete nutrients, it is very common for different drugs, like birth control, for example, can deplete certain B vitamins, magnesium, etc. You can look up on the internet very easily the drug name and nutrient depletions. And there are some websites that will actually categorize these different depletions. For example, methotrexate, which is an immunosuppressant, will deplete folate. You have to supplement with folate. You're required to as part of the profile of using it. So your doctor should actually make that recommendation. But all drugs come with potential risks like this. And so whatever medications you're on, they don't all deplete everything. And in some instances, they can be sparing. So meaning that they could actually cause a buildup of certain things, like certain diuretics can spare potassium, and that's where potassium supplementation would actually be contraindicated. So before you assume that the drugs that you're taking are fine, I would highly encourage you just to inform yourself if you need to have this conversation with your doctor or get certain labs run, to look up if there are any nutrient depletion issues associated with your medication. That way, you know what labs to ask for, and you can actually have those checked, and then you know if you may need to supplement further beyond what you're getting from your diet. There are certain medications also that you cannot have grapefruit, and that would also include grapefruit seed extract as a supplement, because grapefruit impacts how your liver detoxifies or transforms that particular medication. And that's actually done in phase 1 of liver detoxification, which is known as the P450 cytochrome system. And so that, in addition to certain herbs, like we were talking about cyclosporin, and I believe that grapefruit might be on that list. Another one that also oftentimes can be contraindicated is St. John's wort, taken orally, not necessarily applied topically, because you may find it in certain topical skincare products. And so again, this is where, when you're taking these more serious medications, if you're trying to DIY your supplement regimen and working on your gut and using antimicrobial herbs, you may get into trouble because some herbs can impact how quickly the liver will detoxify these medications, causing perhaps in some instances for them to build up to levels that would not be in your best interest, or to be metabolized too quickly, and thus the drug wouldn't work the way it's supposed to. That's why it's really important to work with a practitioner if you are on these medications. Your doctor might not know. They may know something like the grapefruit seed extract, but some of the other herbs, they may not be aware of those contraindications. And so just underscores the importance of a knowledgeable practitioner. Where holistic therapies can get TSW wrong is that they assume that it is severe eczema and that it responds the same way that severe eczema does. And so what I'll see is that a client will go to a practitioner, they'll have stool testing done, blood testing, etc. And perhaps, as I was saying, you still have the original issue that caused, say, the eczema or whatever initially. Now you have TSW layered over top of this initial problem. They will give them a protocol that is way too hard, way too fast, involves too potent of a combination of herbs, and the person's system cannot adapt to it. They cannot deal with it. And so it makes their symptoms so much worse, and they feel really sick being on that protocol. And so the assumption then is, oh, well, you're just detoxing. And they're not detoxing, they literally can't handle it because their HPA axis in TSW is all over the place. It's really compromised. And so the flexibility that a healthy person would have, and I mean, look, we could use that term healthy on a spectrum, right? But somebody who has some dysbiosis within their GI tract may be able to handle a whole bunch of different herbs in a really hardcore targeted protocol, whereas someone else may not, due to the severity of the dysbiosis or imbalance, and then also how well their body is able to manage the stress from dealing with that. And someone whose HPA axis, so hypothalamus, pituitary, adrenal axis, is able to cope with that level of stress, which TSW throws a huge wrench into that, cannot handle that. And so it is really crucial to find a practitioner who's knowledgeable about TSW, because skin issues are not just gut problems. They are so much more than that. Unfortunately, I know nobody likes to hear that, but that is the truth. And that's why a lot of times, like, you'll flare if you do a liver detox or a gut protocol, because there's other things that have to be taken into account. And when TSW is there, it's now this added layer of complication. It doesn't mean that it's a mountain you can't overcome. It just means that your way in is going to look different than someone who is solely dealing with eczema. The root causes that drive chronic skin issues are not just gut problems or food issues or environmental allergies or your genes or your laundry detergent or whatever it may be. There are a variety of factors, and what I see in my practice is 16 different root causes. It doesn't mean that you potentially have all 16. Usually individuals will have somewhere between 3 to maybe 6 of this root cause combination, which explains why, like, what works for you may not work for me, because our root causes are not the same. But of that 16 root cause list, only one is food, only one is genetic, only one is environmental. And so that leaves a lot to be dug into. And I know it can feel overwhelming at times, like, oh my gosh, I have all these other issues. But what if we looked at it as, oh my gosh, I have all of these other issues, which means I have other possibilities to actually focus on and work on. And that helps bring clarity, right? It's about, how do we look at this situation? And could there be something else going on that we could actually dig into and work on? And I think when you look at it from that perspective, it can be really empowering for the individual. I do think that getting mental health support can be tremendously helpful. And I know that oftentimes clients may remark that they have a hard time finding a therapist who is TSW knowledgeable. But I would argue that the level of trauma and everything else that you've experienced that is causing you to feel how you feel, in many regards, is universal. It may not feel that way because you think that you need someone who's gone through exactly what you've gone through. But the reality is that that's another barrier that prevents you from getting that level of support. And when things are really dark and you are even questioning whether you should be here, because that does happen to some, and we need to be honest about that. Reaching out for help is not weakness. It is the greatest act of self-love possible. And finding someone that you can work through your traumas as well as your distrust in the medical profession, because I recognize that that can happen, is really crucial on your journey, because those traumas don't just magically disappear once you get to the other side of TSW. And you as a whole person need to find the right type of support, especially if you're not getting that at home, if you're not getting that from friends. Remember, those individuals do not have training to understand what you are going through. And even just from a mental health perspective, they don't have the training to know how to support you in the way you may need. And like I said, it's okay to ask for help. In fact, it's true strength and it is true self-love to ask for help.
We're good.